Hello, everyone. A very good morning to everyone, and welcome to Seniors Today and Evergreen Club. Today, we have a very special guest, and it's a sponsored event by Madhavbaug. So, I would like to introduce the topic as well as the doctor for the day. So, the topic for the day is research based Ayurvedic treatment to prevent a heart attack. So, it's the first webinar, and this will be taken by Dr. Gurudatta Amin, sir. So, I would like to introduce him. So Dr. Gurudatta Amin is the Chief Medical Officer at Madhavbaug with over 14 years of experience. He holds a BMSA degree and MD in Samitha and a PGDEMS and is certified as a Six Sigma black belt. Wow. Dr. Amin has published over 50 plus research papers and is an expert in the field of Ayurvedic medicine. Dr. Amin is a highly respected figure in the medical community, having lectured across India and made notable appearances on television as an expert. He leads a team of 600 plus doctors, researchers, product development specialists, patients improvement experts, and 1200 Panchakarma therapists and patient care executives at Madhavbaug. Very wonderful. As a part of this mission to make India free from diabetes and heart attack, Dr. Gurudatta also conducts educational programs for doctors. These programs focus on the reversal of diabetes and heart attack, helping the Ayurveda community treat these lifestyle disorders more effectively. Dr. Amin's dedication to provide high quality healthcare services to patients and advancing Ayurvedic medicine has earned him recognition as one of the India's top 10 chief medical officers. Wow, sir. So, welcome to Seniors Today and Evergreen, sir. I would like you to unmute yourself and start your camera, please.
Oh, I guess I'm very well audible.
Yeah, audible, sir. So, how are you doing this morning?
Very fine, very fine. Today is a Sunday, and just I came from the exercise session. I conduct generally exercise session for my patients, and it was very great day. At the start of the day, it's very exciting because after doing exercises, all the different types of exercises, you get the fitness to fight with the heart disease. So that's what I am right now. So can we start now?
Yeah, we can actually see the glow also on your face with that exercise. So, yes, sir, we can
That's
just start the presentation if you have any, and over to you. And last 5-10 minutes, if there's any query related to heart attack, so you can just put it in the chat box, and doctor will be loving to give you the answers for the same. Thank you.
okay, so we have all the these are the not patients, I will say. They are not doctors. Is it very clear? They are not doctors, right? So I should be speaking in a language which will be understandable to the general population. Is it right?
Yeah, true, sir. True.
Okay, so I will try my best to deliver whatever Madhavbag is doing to convey you what exactly Madhavbag is doing. So let me start with the presentation. And how much time we have?
So we have 20 minutes, and then we can
Oh,
take the question answers.
okay, let's start with the very important topic, which is always a part of a concern for everyone. I guess my PPT is visible to all of you.
Yeah, sir, it's visible. Can you just full screen? Yeah, done. Over to you, sir.
Is it done? Okay, that's very good. So good morning all. आप सभी का स्वागत है यहाँ पर. Today we are going to talk about the heart attack. Heart attack is a condition जो कोई नहीं चाहता अपने जिंदगी में आए. So no one wants this condition to come in a life. Why? Because it is something which is shocking, which is going to cost us as a complete life. So and that's the reason why everyone is concerned about the heart attack and everyone wants to stay away from this serious condition called heart attack. Now, I have a simple question. I guess all of you can participate in the chat so that let this session be interactive. Heart attack. Is it something which is a acute condition or it is something which is a chronic condition? That means, is it a condition which is very short term or it is a condition which takes a long time to develop? So is it a short term or is it acute or a chronic? Does it takes a short while or it's a long term? Please let me know what you think. Is it a acute or a chronic? So it's very clear that this condition, what we call it as a heart attack, is generally acute. It is not a chronic. No one says that, doctor, I'm having a heart attack since last 5 years. No one says like this, isn't it? Whenever the patient comes to me, he is not going to say me, doctor, I'm having a heart attack since last 10 days. Heart attack is an acute condition. One more thing about it, which is very important. Patient says, I had an heart attack. That means heart attack comes and goes. It's not the permanent entity. Is it a permanent entity? Please let me know. Is it a permanent entity? So if someone gets a heart attack, is it a permanent entity, or they say like this, ki आया था या आके गया hai? Is it a permanent entity? No, it's not a permanent entity. So please understand that heart attack is a condition where there is a blood clot formation in your blood supplies blood art coronary arteries which are supplying blood to your heart itself. So when you get the blood clot formation in your pipeline which are supplying the blood to heart itself, that is a condition called heart attack. Now just give me another answer. A blood clot is a root cause of this heart attack. How much time it takes for blood to get clotted? How much time it takes for blood to get clotted? So blood clot कितने time में होता है? Few minutes, few hours, or few years? What would be your answer? Blood clot. If I say blood clot, how much time it will take? Few minutes, few hours, or few years? Please let me know what you think about it. Few years, few minutes. So there are the difference of opinions. Okay, few minutes, few years. Few of them are saying few years. Shilpi, Vishwas, few years, few minutes. It's very clear that blood clot. When you get a blood clot, whenever you get any wound or any cut, the blood starts flowing out, and when blood starts flowing out, it gets clotted. So clotting is a natural mechanism, natural protective mechanism, and that happens within few minutes. So heart attack is a condition which can develop in anyone's heart within minutes. Make it very, very clear. It's just a pathophysiology which takes hardly few minutes. When we talk about the blockages, yes, blockages takes years to develop. It's not the pathophysiology of 1 day or 2 day or 1 minute or 2 minute. Heart attack is a pathophysiology which takes hardly few minutes to develop. Blockages is a pathophysiology which takes years or decades to develop. So there is a great difference between a heart attack and the blockages. When you have a blockages, you have a fat accumulation in your heart. When you have a heart attack, there is a blood clot in your heart. Now, let's move ahead. We are bothered more about blood clot or blockages. Give me your answers. आप ज्यादा चिंतित किसके बारे में होंगे? About the blood clot or fat accumulation in your coronary arteries? So is it a fat which gets accumulated in the blood vessels, blockages? Is it a serious, or blood clot in pipeline is a serious? Now let me tell you, blood clot in your coronary is heart attack. Blockages in your coronary is not a heart attack. There are many patients, I guess there must be a patient in this webinar also who are having a blockages, but they don't have a heart attack. For heart attack to develop, what you need is a blood clot. So what is a serious pathophysiology? Is it a blockages? Is it a serious pathophysiology, or heart attack or the blood clot is a serious pathophysiology? I will say the blood clot is something which is really, really very risky, and it can take you to the heart attack, and from heart attack you can land up into the cardiac arrest. So this is a condition which is very important to be prevented. So what I want to tell you now, I'm going to give you a few tips so that you can stay away from this problem of blood clotting in your coronary arteries. And second thing, I will give you certain tips so that you can stay away or you can stay alive in the phase of heart attack. Because the research says that if 100 patients gets a heart attack today, then out of those 100, 15% will die immediately. So out of 150 will die, 15 will die immediately, right? These are the statistics. Okay. So just I want you all to please focus on these numbers. Out of 100 patients who are going to get a heart attack, 15 will die immediately. Near about 60 to 65%, they will suffer some sort of a chest pain, breathlessness, giddiness, perspiration, and the rest of the cardiac symptoms, and they will be shifted to hospital. After shifting to hospital, they will receive the medication, and after 6 7 days they will come out of the hospital. They are survived, they have recovered from the heart attack, and now they are very well. So this will happen with near about 60 to 65% patients. Now remaining 20% patients, so 15% have immediately lost their life. 60% or 65% went to the hospital and well treated, and then they survived. Remaining 20%, they won't be able to identify or recognize or sense that they have an heart attack because they will be having absolutely no symptom. Though their heart is going through the phase of heart attack, they won't be having any symptoms. So there are three classes. First 15% immediately expires, 60% goes to the hospital, and third one will not be able to recognize a heart attack after 5, 6, 7 months. When that patient will go to the doctor and take the ECG or 2D echo, the doctor will tell to that patient, oh, you had an heart attack. So you have gone through the heart attack condition. Patient will say, no, I don't know. But doctor will say your ECG, your echo is saying that there are the evidences of heart attack. So these are the three conditions. First, 15%, 65%, and 20%. Now I have a simple question for you. Out of these three, which heart is powerful? Is it a first one, 15%, 60%, 65%, or 20%? Which heart is a powerful? Just give me the classification. Which heart will be having a most powerful condition or the situation because of which it has survived the heart attack? First, second, or third? I hope all of you will agree with me that the third person, 20% patients who have survived the heart attack without any symptom, they have certain conditions in their heart because of which they have survived this crisis. So now, dear friends, today I'm going to talk more about how you can stay away from heart attack and how you can actually stay alive in the face of a heart attack. Let's move ahead and understand this heart attack into the more depth. Okay, so I'm not going to talk more about the seriousness of heart attack, because every minute 40 people are dying due to the heart attack in India. This is the number, and what are the reasons for it? We all are aware that the diabetes is a major cause, blood pressure is a major cause, then we have a smoking, then we have a stress, then we have a anxiety, then we have a family history and abnormal lipid profile. So all these are contributing to the heart attack. Now let's talk one by one. When we talk about diabetes, those patients who are having a diabetes, they manage their blood sugar levels with the help of medicines, right? When you're managing your blood sugar levels with the help of medicines, what exactly you are doing? Are you aware that whenever you are managing your blood sugar just with the medicine, you are just hiding the problem? You're not actually treating the root cause. Instead of that, you are just hiding the problem, just putting all the problems below the carpet. So that's what the strategy you're using when you're using medication to control the blood sugar. Let me give you an example. Two patients are there, Mr. Vijay and Mr. Ajay. So two patients, both of them are friends of each other, and both of them are there at the family function, and both of them have a diabetes, 40 age, diabetes, and now they are going to the lunch and the buffet, and they have seen the gulab jamun, and both of them have consumed near about four gulab jamun, and after taking four gulab jamun, Ajay and Vijay, both of them have seen the blood sugar 300. So blood sugar has gone up to 300. Ajay and Vijay, 4 gulab jam. After that, blood sugar 300. Now what has happened? After that, when Ajay has realized that he has consumed the 4 gulab jam and now the sugar has gone up to 300, he decided to go out and go for a walk for 30 minutes. He went out and just had a walk for 30 minutes, and after coming back from the walk for 30 minutes, he checked his blood sugar. It came to near about 200. Now, this has happened with the Ajay. Now, what was the story with the Vijay? So, Vijay has consumed the tablet, and after consuming the tablet, his sugar also came down from 300 to 200. So, both of them have managed to reduce down their blood sugar by 100. Ajay has, done the exercise for 30 minutes, and Vijay has consumed one tablet, and because of which his sugar has gone down by 100. Ajay is also on 200. Vijay is also on 200. Now, you tell me, in case of Ajay, how the sugar has came down, where the sugar has gone now. It was 300 before exercise. After exercise, it came down to 200. What has happened with the 100 mg per dl sugar? What has happened with the 100 mg per dl per dl sugar is that sugar got consumed during the exercise, and that sugar is now not there in his body. But now, if you look at what has happened with the Vijay has consumed the tablet, and because of the tablet, the sugar is now not there in the blood. Now, my question is, because of tablet, now sugar is not there in the blood. From 300, it came down to 200. Where is that 100 mg per dl? Is it still in his body or it is out of his body? Please let me know what you think about it. What has happened with the Vijay? He has consumed one tablet, and after consuming one tablet, his sugar has came down from 300 to 200. My simple question is, where is that 100 mg per dl sugar? I want answers from every one of you who is a diabetic. Please think on it very seriously, because let me tell you what these all allopathy medicines are going to do. If you see to the mechanism of action of majority of allopathy medication which are being prescribed for the management of sugar, which includes a pioglitazone or sulfonylureas or the sitagliptins, or that is called as a DPP-4 inhibitor, what they are going to do? They are going to convert this sugar into fat and going to store that fat in your own body. Now just imagine, you are taking a medication to control the sugar. That medicine is controlling the sugar, how it is converting that sugar into the fat and storing that fat in your own body. Now tell me, is it a right way to deal with the diabetes? Please let me know what you think about it. Is it a right way to deal with the diabetes? I want answers from everyone. Come on, please let me know if you are taking a medicine and then your reports are normal and you're happy, your doctor is happy, but your body is not happy. Please mind it very well. Taking this medication and controlling sugar is like we are fooling ourselves. So that should not be the strategy. A type 2 diabetes is 100% reversible. I'm saying 100% reversible. It can be completely reversed. What you need to do, you just have to lose at least 10% of your body weight. You just lose the 10% of your body weight and get rid of this diabetes medication. That's what we do at Madhavbaug. We treat the diabetes, we reverse the diabetes just within 90 days. You have to give me a complete 90 days dedicatedly, and with the help of those 90 days, with the help of diet, Panchakarma, exercise, lifestyle modification, your diabetes can be completely conquered. And let me tell you that what is the evidence that the diabetes is now cured. The definition of diabetes reversal is if you can pass glucose tolerance test, then it indicates that your diabetes is now completely gone. It is now normalized because now your body has got the capacity to metabolize 75 grams of glucose. Just imagine 15 spoons of glucose or 75 grams of glucose, or I can say near about 15 jalebis. If you can metabolize that sugar, and if even after consuming 75 grams of glucose, if your blood sugar comes to normal level after 2 hours, that indicates that your diabetes is gone. And that's what we are doing. My point of concern is all of you, if you're diabetic, I'm not saying that immediately come to Madhavbaug. I will say just start changing your lifestyle. Do not accept the, I will say, dependency on these oral hypoglycemic agents, because slowly and gradually, these oral hypoglycemic agents or the allopathy medications are taking you towards heart disease, because they are converting the sugar into the fat and storing it in your own body. The risk of heart disease increases significantly when you take excessive medication for the management of blood sugar. I hope everyone is clear with this. So from tomorrow onwards, what you need to do: morning 30 minutes exercise. How many of you have done the exercise today? Please give me a thumbs up. How many of you have done the 30-minute exercise today? So come on, give me thumbs up if you have done it. Come on, give me thumbs up if you have done it. If you haven't, then say no, and from tomorrow just start it. Not required to start from tomorrow. Even after this session, even before your lunch, you can go for a 20-minute walk. Is it possible? Yes, it is possible. You can go for a 30-minute, 20-minute walk. Just go for 20-minute walk, burn out the sugar, and see how your heart smiles and how your sugar and everything gets normalized. So it is very much required. So every one of you start doing exercises. Second thing, consume minimum 100 grams of salads, 100 grams of salads before lunch. So from today onwards, I want this change to happen in everyone's life. So before you go for a lunch, please have 100 grams of salad. Eat whatever salad you want to eat, but eat 100 grams of salad before starting your lunch or dinner. So before lunch and dinner, start consuming 100 grams of salad. That is going to give you a huge benefit in reversing your diabetes. So that is what is very essential, because ultimately this sugar is contributing in diabetes, not only diabetes complication, but also in developing the pathophysiology of heart attack. So हार्ट अटैक निर्माण करने के लिए भी ये शुगर उतनी इंपॉर्टेंट है। तो गोलियां बंद करनी है हमने, और गोलियां बंद करने के बाद आप देखोगे कि आपकी सेहत बहुत अच्छी इंप्रूव होगी। There are certain questions I will just try to answer as much as possible. Where is the fat deposited in the body? Yes, your body stores fat in liver, then viscera, abdominal fat. Many of us have observed that our hands and the thighs, they start shrinking after getting a diabetes. And just the abdomen starts, the size of abdominal girth or abdominal girth starts increasing day by day. And after 5 to 6 years of diabetes, you can easily identify a person who is having a thin hands and the legs, and the tummy size is big. If this is a pathophysiology, it can be called as a diabetes. There are so many patients I've seen. So what you want to do? You want to do the exercise. You have to do the you have to consume the 100 grams of salad. So that's what you're going to start from today itself. And that's what is going to help you to get rid of this additional fat which is getting deposited in your liver, in your viscera, and in your pancreas also. So what you need to do, you need to eliminate all that fat so that your body will be free from the fat and you will be completely healthy. So that's what the strategy is. So remember my words, that diabetes is reversible. What you need to do, you need to just execute the scientific way. In Madhavbaug, we are reversing this diabetes. So if you, any one of you wants to, reverse the diabetes and want to know what exactly we are doing in diabetes, then definitely visit our clinics. Is honey good for diabetes? No, Shamla ji, sorry for that, because the honey also contains a huge amount of sugar. We have done the experiments with honey. We have done the experiments with jaggery, and we have seen that there is no benefit of jaggery or the honey. It is going to increase your sugar. Better to stay away from such products. So you have to just believe, I will say you have to just be dependent for sweet test on stevia, not sugar, not honey, not jaggery. Yeah, I hope that is very clear. Less carb will help. Yes, Shilpi ji, definitely it is going to help. So for diabetes, it is reversible. So if you have this disease in your body, do not stay with it. Do not live with it. Do not allow this diabetes to control your body, because it is a silent killer. Slowly and gradually, it is going to affect your eyes, your vision, your skin issues, your kidneys, your heart, your brain, your nerves, your muscles. Every part of body gets affected because of this diabetes. So if you really want to reverse it, then please start modifying your life. Take the charge of your life. Take the control of your life. Do not surrender to this medication, because these medications are not going to help you. Slowly and gradually they are going to damage you. What is the alternate of sugar? Alternate of sugar is a stevia. So stevia is a herb which can be consumed. So you go to the market and search for the stevia. You will get it in our all our clinics, 360 clinics and 4 hospitals. We have that special product for stevia, for which we give to our diabetic patient. So for diabetes, yes, that's a solution. Let's talk about the smoking, tobacco, alcohol. Look, smoking, generally, every one of you, that smoking is not a good habit. We all are aware about it, isn't it? But if you are smoking, then please understand that are the high possibilities of the stroke. Yesterday, I was there in one, post-stroke rehabilitation center. I saw a young champ, 32 years old. One young champ was 28 years old, and they had got the paralysis. Now, just imagine the life after paralysis. Whenever, if you're smoking, if you're drinking, if you're consuming tobacco, please do visit a center where the paralysis patients are getting treatment, because that will give you a strong support or the strong boost to get rid of these bad habits. So smoking, tobacco, alcohol, please stay away from all these things. About alcohol, one basic principle. About alcohol, one basic principle. What is that basic principle? About alcohol, the principle is dilution, duration, and diet. If you're consuming alcohol, minimize the quantity. Take it for longer duration, longer period. Do not, finish it in a one shot. No, that's not a good habit. Your liver will be at a bad stress if you're doing that. So if you're consuming alcohol, try to minimize the quantity, try to dilute it and increase the duration, and take care of the diet. If you do that, then possibility that the alcohol will damage or will reduce down. But ultimately, alcohol is not good for the diabetes, not good for heart disease, not good for blood pressure. It is a really bad thing, and it should be stopped. Then family history. If you have a family history of heart disease, then the possibility of heart problem definitely increases. We have gone through certain genome studies, and non-diabetic can take, yes, definitely non-diabetic also can take the stevia. The Keshav Kapgate is saying high protein, high fiber, low carb, low fat, increase exercise. Yes, perfect. That's what we have to do. And if you start doing that it from today itself, now see the magic. Within 1 month, you will see a very good reduction in your blood sugar. Whenever you see the reduction in blood sugar, what you need to do? You need to taper down the allopathy medicine. If you take the medicines and you try to put the efforts in terms of diet, exercise, then your sugar will fall down and it will go below the normal, and that may induce certain symptoms like a giddiness or the restlessness or the excessive hunger. So what you need to do when you are modifying your lifestyle, एट द सेम टाइम जब आप आपकी जीवन शैली सुधार रहे हो, उसी समय आपने आपकी एलोपैथी की गोलियों को भी कम करना है। अगर नहीं कम किया तो दिक्कतें बढ़ेगी या नहीं बढ़ेगी, प्लीज लेट मी नो। एक व्यक्ति है जो अपनी लाइफस्टाइल सुधार रहा है, एक व्यक्ति है जो अच्छा डाइट फॉलो कर रहा है, एक्सरसाइज कर रहा है, और एलोपैथी की 4 गोलियां चालू थी पहले, अभी भी 4 ही गोलियां ले रहा है। उसने वो गोली बंद करनी चाहिए या नहीं चाहिए? प्लीज लेट मी नो वेदर ही शुड स्टॉप दोज मेडिसिन और नॉट। कम ऑन, लेट मी नो। इफ ही स्टार्ट्स इंप्रूविंग हिज लाइफस्टाइल, whether he should stop his medicines or not, उसने गोलियां बंद करनी चाहिए या नहीं करनी चाहिए? अगर उसने अपना डाइट इंप्रूव किया है, एक्सरसाइज इंप्रूव किया है, रेगुलरली सारी चीजें कर रहा है, अगर ऐसे कंडीशन में उसने गोली नहीं बंद की ना, तो वो दिक्कत में जाने वाला है। प्लीज माइंड इट वेरी वेल। You need to reduce down the dosage of allopathy medicine when you start following. Problem क्या होता है? Generally patient they follow a good lifestyle, and with the good lifestyle they take the allopathy medicine. When you follow good lifestyle and after that you take the allopathy medicine, you will feel good or bad? Please let me know. Will you feel good or bad? If you follow good lifestyle and in spite of that you are taking allopathy medicines for controlling sugar, will you feel good or bad? आपको अच्छा लगेगा या बुरा लगेगा? नहीं, आपको बुरा लगेगा, बिकॉज गोलियां आपकी शुगर नॉर्मल से भी कम लेके जाएगी। एंड देन यू विल गेट द चक्कर, थकान, वीकनेस, परस्पिरेशन, ये सब होगा। आपको क्या लगेगा फिर? आपको लगेगा अरे मैं डाइट कर रहा हूँ इसके वजह से हो रहा है। देन यू विल स्टॉप डाइट एंड देन यू विल स्टार्ट कंज्यूमिंग योर ओल्ड डाइट। सो गुड हैबिट्स के साथ साथ आपने गोली भी बंद करनी है। प्लीज मार्क दिस पॉइंट, इज अ वेरी एसेंशियल पॉइंट। आई हैव सीन सो मेनी पेशेंट्स, दे पुट एफर्ट्स टू रिवर्स their diabetes, but then they stop in between because they start feeling uneasy. That uneasiness is not because of the diet what they are following, that uneasiness is because of the medication. जब तक डॉक्टर नहीं कहेंगे तब तक बंद नहीं करेंगे, वेरी ट्रू। बट इसी के लिए डॉक्टर भी ऐसा होना चाहिए जिसे लाइफस्टाइल मॉडिफिकेशन के साथ साथ डायबिटीज रिवर्स होता है ये मालूम होना है। Please understand it very well. In Madhavbaug, we have developed a drug tapering protocol. Just go and ask any doctor whether they are aware about drug tapering protocol, how to taper down the medicines. Allopathy की गोलियां कैसे बंद करनी है? चालू करना तो सबको मालूम है, बंद कैसे करनी है, उसका सीक्वेंस क्या होना चाहिए, उसका प्रोटोकॉल क्या होना चाहिए। So that's what we are doing. लीना जी 100 steps, sorry 10,000 steps आपने चलने हैं। हाउ मेनी स्टेप्स वॉक डेली? 10,000 स्टेप्स चलने हैं, लेकिन 10,000 स्टेप्स के साथ चलो ये बात छिड़ी गई है तो आगे का पॉइंट में कवर कर लेता हूँ। स्टेपिंग एक्सरसाइज, आप अगर वॉक की बात करें तो वॉक के साथ साथ स्ट्रेचिंग भी होना चाहिए, बैलेंसिंग भी होना चाहिए, रेस्पिरेटरी एक्सरसाइज भी होना चाहिए और वेट ट्रेनिंग भी होना चाहिए। सो एक्सरसाइज इज नॉट जस्ट वॉकिंग, वॉकिंग के साथ साथ मसल ट्रेनिंग, डंबल्स भी करो, स्ट्रेचिंग यानी योगा के अलग अलग पोजेस भी करो, बैलेंसिंग यानी हम अगर वृक्षासन देखें, ताड़ासन देखें, ये आसन भी करो जिससे आपकी बॉडी के नर्व्स अच्छे होंगे। रेस्पिरेटरी यानी सांसों का नियंत्रण, बिकॉज दैट इज वेरी मच इंपॉर्टेंट टू कंट्रोल योर स्ट्रेस लेवल्स, टू कंट्रोल योर फास्टिंग ब्लड शुगर लेवल। अनुलोम विलोम, ये चीजें भी आप करो। डॉक्टर बोलते हैं जब तक जियोगे मेडिसिन लेना ही है। ऐसे डॉक्टर के पास फिर मत जाओ, ऐसे डॉक्टर के पास जाओ जो आपको मदद कर सकेगा एलोपैथी की गोलियां बंद करने के लिए। दैट इज व्हाट यू नीड टू सिलेक्ट नाउ, कि आपको कहाँ जाना है। ऐसे डॉक्टर जो डायबिटिक रिवर्सल कमिट करता है उसके पास जाके आप ये चीजें चीजें कर सकते हो, एंड दैट्स व्हाट वी आर डूइंग। और इसीलिए मैं कह रहा हूँ कि यस डायबिटीज रिवर्स होता है। आपको बता दूं, मैं अभी फिलहाल हमने एक डायबिटीज का इवेंट लिया जहां पर हमने डायबिटीज रिवर्सल करवा के दिखाया। 1300 पेशेंट का जीटीडी किया, 1300 पेशेंट्स हैव अंडरगॉन द प्रोसेस ऑफ जीटीडी, ग्लूकोज टॉलरेंस टेस्ट, एंड दैट टेस्ट केम निगेटिव। 1300 पेशेंट एट अ टाइम हमने किए थे, वो एक प्रकार का बड़ा इवेंट हमने किया था। तो ये प्रोसेस है जो माधोबाग कर रहा है। सर्च अबाउट अस ऑन द गूगल, सर्च अबाउट अस ऑन द वेबसाइट और the YouTube, and you will get to know many things about the Madhavbaug diabetes reversal concept. So let's move ahead from diabetes. Yes, walk barefoot on grass and earth is really very good, but condition is applied. आपके पैर अच्छे होने चाहिए। ऑलरेडी आपके पैरों में न्यूरोपैथी है, आपके पैरों में बहुत सारे डायबिटिक चेंजेस हो चुके हैं और ऑलरेडी आपको डायबिटिक वुंड के चांसेस ज्यादा है। ऐसे कंडीशन में आप बेयरफुट चलोगे, वुंड होगी, वो जख्म समझेगी नहीं तो दिक्कतें और बढ़ेगी। इसलिए बेयरफुट वॉक किसे अच्छा है? जो कंप्लीटली नॉर्मल है, हेल्दी है। समझो मैं अभी चलता हूँ और चलने के बाद मुझे कुछ तो कांटा लगता है, समझ में आएगा तुरंत, मैं उसके ऊपर थोड़ी सी हल्दी वगैरह लगा दूंगा और 2-3 दिन का ख्याल रखूंगा, ठीक हो जाएगा। लेकिन डायबिटिक हूँ, शुगर 400 है और बेयरफुट चल रहा हूँ, और 400 शुगर के साथ बेयरफुट चलने के बाद कहीं तो कट हुआ और समझा ही नहीं वो कट हुआ है, वहां पे इन्फेक्शन हुआ, पैर में डायबिटिक वुंड चालू हो गई, तो प्रॉब्लम बढ़ेगा या कम हो गए? सो बेयरफुट चलना किसके लिए फायदेमंद है? जो नॉर्मल हेल्दी इंसान है। डायबिटीज के लिए पहला काम क्या करो? पहले डायबिटीज को कंट्रोल करो। बेयरफुट से ज्यादा इंपॉर्टेंट होगा, पहले डाइट को कंट्रोल करो, वजन कम करो, एक्सरसाइज रेगुलर करना चालू करो, तब जाके आप इस प्रॉब्लम से बाहर निकलोगे। चलो मैं आगे बढ़ता हूँ। डायबिटीज इज डन। स्मोकिंग टोबैको छोड़ देना है, अल्कोहल छोड़ देना है, ओबेसिटी, वजन से प्यार मत करो, वजन कुछ काम की चीज नहीं है, उसे जल्दी से जल्दी बंद करो। ओके, सो दिस इज व्हाट आई वांट टू से। आगे बढ़ता हूं मैं, बिकॉज वी आर रनिंग शॉर्ट। मैंने जैसे कहा था कि हार्ट अटैक के बाद ना, हार्ट अटैक के बाद एज आई सेड द हार्ट अटैक कॉज ब्लड क्लॉट, ब्लड क्लॉट की वजह से हुआ। ब्लड क्लॉट के बाद there could be a three conditions. First is 15% death, then 65% goes to hospital, and third one is no symptom. आप सबने कहा कि इन तीनों में से who is the most powerful? The third one is the most powerful. Third one, who is having no any symptom of heart problem, is the most powerful, and that is very true. Now the point of concern is how we can develop that strength in our own body. और second चीज, आपकी condition, if I ask you कि do you have that capacity to sustain the stage of heart attack? क्या आपके पास उस हार्ट अटैक के कंडीशन को सरवाइव करने की, सस्टेन करने की क्षमता है? इफ आई आस्क यू दिस क्वेश्चन, व्हाट वुड बी योर आंसर? अगर मैं आपको ये क्वेश्चन पूछूंगा कि क्या आपके पास हार्ट अटैक के कंडीशन को सहने की ताकत है, आपका आंसर क्या होगा? यस और नो? नो वन नोज ना हार्ट अटैक कब आएगा, नो वन नोज, इवन अ डॉक्टर, आई डोंट नो व्हेन आई एम गोइंग टू गेट अ हार्ट अटैक, मुझे भी मालूम नहीं, बिकॉज हार्ट अटैक टेक्स हार्डली 3 मिनट्स टू डेवलप। सो नो वन नोज कि हार्ट अटैक आने के बाद सर्वाइवल कब होगा, कैसे होगा, वो ताकत आपके पास है कि नहीं। सो आज मैं वो आइडिया आपको देने वाला हूं। देखो, देर इज अ पैरामीटर कॉल्ड VO2 मैक्स। VO2 मैक्स आपके बॉडी का, आपके हार्ट का मैक्सिमम कैपेसिटी सारे शरीर को ऑक्सीजन भेजने का, दैट इज कॉल्ड एज अ VO2 मैक्स। ये नया टर्म है, आप लोगों में से बहुत सारे लोगों ने पहली बार सुना होगा। सो प्लीज 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 आप मुझे बता देना, आप ध्यान में रखना इस वर्ड को, VO2 मैक्स। आप सब लोगों के बाद ध्यान में रखना, द वर्ड VO2 मैक्स इज द मोस्ट इंपॉर्टेंट पैरामीटर। अब ये VO2 मैक्स का मतलब क्या है? इसका मतलब है कि आपके हार्ट की, आपके सारे शरीर को ऑक्सीजन देने की क्षमता, द मैक्सिमम capacity of your heart to deliver oxygen to your body for its metabolic process. So that VO2 max इतना इंपॉर्टेंट है कि 1 ml इंक्रीज, जस्ट 1 ml इंक्रीज, 1 ml भी अगर इंक्रीज होता है VO2 मैक्स, तो 15% चांसेस ऑफ हार्ट अटैक के चांसेस कम हो जाते हैं, डेथ के चांसेस कम हो जाते हैं। सो 15% से इंप्रूव हो जाते हो आप हार्ट अटैक के रिस्क से, अगर आपका 1 ml VO2 मैक्स पड़ता है। अब ये कहाँ लिखा है? ये अमेरिकन हार्ट एसोसिएशन का गाइडलाइन है। मेल में कितना होना चाहिए? 30 ml पर केजी पर मिनट, सॉरी 35 ml पर केजी पर मिनट। फीमेल में होना चाहिए 30 ml पर केजी पर मिनट। अब ये VO2 मैक्स किस चीज पे निर्भर है? फर्स्ट, आपका हार्ट अच्छा चाहिए, मसल्स अच्छे चाहिए, लंग्स अच्छे चाहिए, हीमोग्लोबिन अच्छा चाहिए। ये चार चीजें अच्छी होगी तो आपका VO2 मैक्स अच्छा होगा, और ये VO2 मैक्स अगर अच्छा है तो आप हार्ट अटैक से आराम से बच सकते हो। और ये VO2 मैक्स पता कैसे चलता है? पता चलता है स्ट्रेस टेस्ट पे। क्योंकि ये एक ही ऐसी टेस्ट है, स्ट्रेस टेस्ट एक ही ऐसी स्ट्रेस है जिसमें आपके हार्ट को भगाया जाता है, और भगाने के बाद उसकी ताकत को नापा जाता है। डोंट यू अंडरस्टैंड? What is the specialty with the stress test? Stress test is an investigation जिसमें आपके हार्ट को स्ट्रेस दिया जाता है, भगाया जाता है, और भगाने के बाद हार्ट का ब्लड सप्लाई ECG लीड्स के माध्यम से नापा जाता है। So it is the only dynamic investigation where the rate or the workload on heart is increased, and then we check the blood supply to the myocardium. So it is the only test in which your heart is actually put into the controlled stress atmosphere, and then the performance your engine is checked. It's same like that when we go for a, to buy a new car or take a test drive. What we do, we go to the car showroom and ask them for a test drive, and then we actually try to drive the car and see how the machine or engine is performing. So the same way, the heart's stress test is something like that. We are going to ask your heart to do the maximum workload, and during that maximum work we are going to assess the functionality of your heart, whether it is receiving sufficient amount of blood or not, and whether it is capable to deliver the enough amount of blood to whole body or not. So this is a stress test जो आपको आपके हार्ट अटैक के नंबर के बारे में बताएगा कि हार्ट अटैक से लड़ने की आपकी ताकत है या नहीं। अब मैं पूछता हूँ आपको, आप में से कितने लोगों को आपके हार्ट की ताकत, मेल्स को 35 होनी चाहिए, फीमेल की 30 होनी चाहिए। हाउ मेनी ऑफ यू आर अवेयर अबाउट योर हार्ट्स VO2 मैक्स? आप में से कितने लोगों को आपके VO2 मैक्स की ताकत, VO2 मैक्स की क्षमता मालूम है? हाउ मेनी ऑफ यू आर अवेयर अबाउट दिस नंबर VO2 मैक्स? आर यू अवेयर अबाउट योर हार्ट्स VO2 मैक्स? Yes or no? Please let me know. Yes or no? If you don't know, and if you really want to stay away from heart attack, and if you really want to live a very good and healthy life, disease-free life, then you should go for stress testing. So stress test is a test in which you will come to know about your heart's functional capacity, about your heart's blood supply, and that's the way you try to judge your cardiovascular fitness. So ये cardiovascular fitness के लिए बहुत अच्छी, सबसे अच्छी, I will say the most important, because it is the only test in which you will be asked to run on the bed. You go for angiography, you will be sleeping. You go for a 2D echo, you will be sleeping. You go for a path lab, you will be resting, and the blood sample will be collected. But it is the only test in which the heart will be asked to work hard, and then we are going to check the capacity of it. So the only dynamic test of the heart which is going to give you the exact number. So all of you should go for this stress test. If you have crossed your 40s, if you have crossed your 40s, then please go for this stress test and check your heart's capacity. If you have a diabetes, the stress test is the must for you. If you have a hypertension, then please go for it. It is very important. If you have a obesity and the family history of heart disease, you should go for this stress test. If you have any your nearby, blood relative who is having a heart issue like your brothers or anyone, then you should go for this stress test because it is going to give you it is going to help you to detect the problem earlier. And that's the important strategy, isn't it? Detect the problem earlier helps you to solve that problem with minimal intervention and the minimal cost. When the problem increases, the cost, the treatment duration, as well as the possibility of reversal or the possibility of complete rehabilitation, that also goes down. The cost increases, the duration increases, then the possibility of complete rehabilitation or complete normalization of the cardiac function, that also reduces. And that's the reason why you should detect the problem earlier. So if you go for a stress test, then you will be able to get to know what is exactly your heart's functional capacity or your VO2 max. So this is the stress test on which computerized stress test on which you will be able to get to know what exactly is your heart condition. Now, there is one now good thing what I have brought for you. Okay, so please understand how to improve the VO2 max. With the help of research-based treatments, you can improve the VO2 max. About Madhavbaug, let me give you some introduction. Madhavbaug is a research-based organization which has developed a number of therapeutic protocols for cardiac patients, for hypertensive patients, for diabetic patients, for obesity patients, for hypothyroid patients. We have developed the different protocols, and all these protocols are research based. The best thing with Madhavbaug protocols is these protocols are internationally accepted. The research papers are published into the Lancet Journal, then the Indian Heart Journal, then the Journal of Association of Physicians of India, CHAPI. So we have published our data and our protocols and our findings and our results in national and international journals, and that's the reason why these therapies are now worldwide accepted. So these are the therapies. So what we are treating, how we are treating. So this is a RCT, randomized controlled trial. This is a very important trial which says that the Madhavbaug therapy is 40% more effective than the allopathy medicine to improve the VO2 max. Now, let me tell you this trial was conducted in cardiologist hospital itself. So the cardiologist was principal investigator. Dr. Abhijit Aklutskar sir was the principal investigator. Atul Patil was the principal investigator, and they have done this. So what we do, we actually give the diet with the help of which we reverse the blockages, and that's the reverse diet kit. We have a diet kit called Reverse, which helps to reverse the blockages. Then we have exercise protocols. We have the MIB Pulse app. We have the exercise sessions. Then we have a Panchakarma therapy protocol. So with the help of Panchakarma, exercise, diet, we reverse the heart disease. Yes, Panchakarma is the so much so powerful. How many of you have gone through the Panchakarma procedures? Let me know about it. How many of you have done the Panchakarma once at least in your life? Please let me know how many of you have gone through Panchakarma procedures at least once in your life. Panchakarma is such a procedure which is going to help you to actually detoxify your body. And this detoxification word is very, very, very important, because generally in our life we keep on accumulating the unwanted toxins in our body, which comes either from the packed food or from the lifestyle what we are living, or the medication what we take, which are generally unnecessary. So what happens because of all these things? It keeps on depositing the toxins in your body. Once you start eliminating these toxins, you will start feeling the actual strength of your body, and that's where the Panchakarma helps you. This Panchakarma is going to help your heart to improve its blood circulation, to improve its functional capacity, to reduce down the diabetes, to reverse the blood pressure, to reverse the hypothyroid. So Panchakarma is a procedure which is really the most powerful intervention of Ayurveda. And that Panchakarma therapy, Madhavbaug has done a remarkable research in this field about the Panchakarma therapies in the cardiovascular diseases, and we have published the data. And with these therapies, we have reversed more than 10 lakhs of patients till now through our 340 clinics and the 4 hospitals. So that's what we do. Panchakarma, exercise, diet. We have our diet kit, and with the help of that, we reverse the diabetes. Okay, these are the procedures with the help of which your heart actually starts improving, your heart's blood supply, your heart's functioning capacity, your diabetes control, everything starts improving. So now, our mission, Madhavbaug as a mission, we have a mission to make the heart disease free, India, and that is definitely possible. We are working hard to actually achieve it. And now we have launched recently a campaign called Arogyam Hruday Sampada. This campaign is specifically for those who are senior citizens. Okay, so anyone who is sitting over here in this Zoom session, अगर आपकी उम्र 60 के ऊपर है, तो आप इस आरोग्यम हृदय संपदा कैंपेन का पूरा इस्तेमाल कर सकते हो। ये क्या कैंपेन है? ये कैंपेन कैंपेन ऐसी है जहां पर आपको फ्री स्ट्रेस टेस्ट मिलने वाली है, बिकॉज वी हैव लॉन्च दिस कैंपेन रिसेंटली। और इस कैंपेन के तहत हम 1 लाख फ्री स्ट्रेस टेस्ट करने वाले हैं। So we are going to perform 1 lakh free stress test for senior citizens. So अगर आप में से किसी की उम्र 60 के ऊपर है, तो यहाँ पर मैं एक नंबर आपके लिए पेस्ट कर रहा हूँ। उस नंबर पर आप बिल्कुल कॉल कर सकते हो, और कॉल करने के बाद जो आपको नंबर अभी मैंने पेस्ट किया है, आप सब लोग देख लो। उस नंबर पर कॉल करने के बाद आपको कूपन आएगा आपके व्हाट्सएप पे। सो व्हाट यू नीड टू डू, यू जस्ट हैव टू गिव अ मिस कॉल। मिस कॉल देना है, डायल कर देना, मिस कॉल लगेगा। मिस कॉल वो बोल देगा कट हो गया, ठीक है, कट हो जाने तो कोई दिक्कत नहीं। एक भी कॉल आपका लगा, यानी मिस कॉल लगा, मिस कॉल लगने के बाद आपके व्हाट्सएप पे ये मैसेज आने वाला है। सो ये इस नंबर पर जब आप कॉल करोगे, सब लोग ये नंबर जरा लिख लेना और बाद में इस पे मिस कॉल देना। 02048552566। चैट बॉक्स में भी मैंने शेयर किया है, लेकिन फिर भी मैं कह रहा हूँ, 02048552566। इस नंबर पर आपने मिस कॉल देना है। मिस कॉल देने के बाद आपको ऐसे मैसेज आएगा, और इस मैसेज में आपको पूरे कूपन दिए जाएंगे जहां पे आप स्ट्रेस टेस्ट कर सकते हो। और वो स्ट्रेस टेस्ट माधोबा की किसी भी क्लिनिक में जाकर आप कर सकते हो। वो फैसिलिटी आपको मिलने वाली है, जिसकी कॉस्टिंग करीबन 1800 से 2000 रुपए तक होती है। बट ये स्ट्रेस टेस्ट आपको फ्री मिलेगी। यहाँ पे कंडीशन होनी चाहिए, आपकी एज 60 के ऊपर होनी चाहिए। अगर ऐसा है तो आपको ये फ्री स्ट्रेस टेस्ट का कूपन मिलने वाला है। सो आप हमारे किसी भी क्लिनिक में जाके ये फ्री स्ट्रेस टेस्ट कर सकते हो, जो आपको बातें यानी इंफॉर्मेशन देगी कि आपके हार्ट का VO2 मैक्स कितना है। क्योंकि हमने देखा था कि VO2 मैक्स एक बहुत इंपॉर्टेंट पैरामीटर है। मेल्स में वो 35 चाहिए, फीमेल्स में वो 30 चाहिए। अगर वो अच्छा है तो आप हार्ट अटैक की कंडीशन में, थर्ड कंडीशन में, जहां पर कोई भी सिम्टम नहीं आता है, उस कंडीशन में जा सकते हो। बिकॉज अगर आपका VO2 मैक्स 35 है, इसका मतलब आपका कोरोनरी फ्लो रिजर्व अच्छा है, आपके हार्ट का रिजर्व ब्लड सप्लाई अच्छा है। इफ यू हैव अ गुड रिजर्व कैपेसिटी इन योर हार्ट, then you will be able to fight with the heart attack very confidently, and the heart attack is not going to defeat you. You are going to conquer the heart attack. तो ये चीजें करने के लिए आप जरूर हमारे क्लिनिक में विजिट कीजिएगा। So that's all from my side. I hope every one of you would like to go through the stress test. If you are you are happy with this concept of stress test, then please do that. हर रोज सुबह एक्सरसाइज करना, हर रोज डाइट में 100 ग्राम सलाद खाना, एलोपैथी की गोलियां जितनी बंद कर सकते हो उतनी बंद करना, ताकि आप फिट रह सको. नाउ वी कैन गो फॉर क्वेश्चन आंसर्स.
Okay. Hi. Thank you, doctor. That was a lovely presentation. And I think so within that presentation only you were involving all the questions which were asked by everyone. So that was a fantastic
Yes,
thing.
yes.
And I would request everyone to please give a missed call on that number and you will get a free stress test computerized which is there. And I'll tell you, if you have any of your friends, family and everyone, see you might be having almost 5 to 10 groups, everyone. Please do post that number as well as this presentation over there. We'll be posting this in an hour or something. हमें नहीं तो किसी और का भला, भला उसका नहीं तो किसी और का सही, किसी ना किसी तक ये बात हम पहुंचाएंगे because Madhavbaug is here with us to help you all. So yes, please give a missed call and thanks a lot and we'll meet you next month again. So if you have any queries related to anything related to Madhavbaug, and yes, they have an app also. So please don't miss कि आप उनका ऐप जाके आप डाउनलोड कीजिए. Any queries like where they have their centers, what all things they do, what all treatments they have, and everything you'll be getting. But yes, if you go through us, you will be getting some discounts also. So thank you, doctor, once again, and we'll see you soon. Thank you, everyone. Take
Thank
care.
you. Bye bye.